Hi, Dr. Fady. It's really great to listen to your talk, and you have a very nice result. Uh, First of all, I'm a surgeon, so I'm not, familiar with this technique, MARPE technique. But I look at your result. I saw some of the class 3 patient you can treat with MARPE, and quite nice results. So I just like to have your comment. When do you choose MARPE? When do you choose SARPE? Or when do you send patient for orthognathic surgery?
Yes. So you're talking about the line between the MARPE and the SARPE.
MARPE, SARPE,
I
and
think
orthognathic surgery. Yeah.
An orthognathic surgery, yes. I will talk about the orthognathic surgery first. When you are going to operate, of course, this is also according to profit. When you are going to operate in the maxilla, for example, maxillary impaction or maxillary advancement surgery, you will do the expansion surgically during the procedure of the low for one osteotomy. So this is a one procedure, and it's done in the theater once. Then comes the SARPE. If you are not going to operate in the maxilla, and for example, you are going to operate on the maxilla by expansion and the mandible by advancement, for example, which is the famous example of the gummy smile, the skeletal 2 mandibular deficiency with gummy smile. I will go for the if you are going to impact the maxilla together with it, you will go orthognathic surgery surgically. But if you are not going to operate on the maxilla and you're going to operate on the mandible, as the patient I've shown in the presentation, I will do the SARPE in the beginning of the treatment and the mandibular advancement surgery in the post-orthodontic phase at the end of the treatment. Talking about the skeletal class 3s, the patients should respond very well according to the evidence below 10 years of age without a micro-assisted expansion. However, at 10 of age, it's not about the suture that is starting to fuse, but actually the cranio-maxillary sutures, which are joining the maxilla to the cranium. These are trying to have greater resistance during the maxillary traction. And in that condition, above the 10 years of age, it is more likely to do a MARPE to increase your opportunity to have more skeletal advancement of the maxilla. And here I want to report the paper in 2000 by my dear professor and colleague, is my friend, Professor Eric Leo, where he developed in the year 2000 the technique of ultramic, whereby alternating rapid maxillary expansion and contraction. I usually this technique when the patient is older than 10 years, to just relax, not about the mid-palatal suture anymore, but about the cranio-maxillary sutures. I want to loosen up the maxillary sutures, especially around the age of 12, 13, and 14 years old, where you are still trying to correct the skeletal 3 non-surgical. It is really smart to introduce something that can release the sutures, the cranio-maxillary sutures, like the ultramic.
Mm-hmm.
Okay, thank you. One other question is that I'm taking care of the patient with chronic event palate, and many of them have contracted maxilla. What is your opinion about this patient with contracted maxilla?
I did a survey among, I think, 150 orthodontists and surgeon, and I asked him a couple of questions. In a nutshell, what will you do in expansion in cleft lip and palate? Actually, if he's young, there's no dilemma for that. There's no controversy for that. You will just do the fan type expander, the quad helix, and so on. He's still in the young age, below around 9 years or 10 years of age. He will respond because the suture and the alveolar cleft is not grafted yet, and everything is open. But actually, if we are talking about a more older age of cleft lip and palate, there is big controversy in that age, which is actually, I'm talking about the patients above 12 years, 14 years, 15 years, and so on. Some responded in my survey talking about that the suture is still patent because there is will never happen a union in the sutures, in the palatal sutures with cleft lip and palate cases. It's already open. So actually any appliance without going for surgical intervention will do. And some responded that, of course, as we go for the rules in orthodontics in the normal cases, above 15 years of age or so, you have to think of surgical expansion. So actually, in the problematic age, what I'm talking about around the 15 years, we need a lot of studies to talk about what is the best approach. Can I expand the already open suture in cleft lip and palate, or should I go for more surgical intervention? Take into consideration that the SARPE is not only for opening, or the surgical expansion is not only for opening the suture, it is also to loosen up the resistance coming from the zygomatic buttress. So if you take this point of view, that you want to loosen up the maxilla from the zygomatic buttress to avoid what we call it the Y shape or V shape tipping, alveolar tipping of the teeth during maxillary expansion, cleft lip and palate, at least he should go for to osteomize the zygomatic buttress to lessen the resistance during the expansion above the 15 years of age. So actually, I think there is no clear protocol for that. Especially for cleft lip and palate, that was my PhD. So the cleft lip and palate patients, the chip implant should be really customized in 100% manner. You cannot apply solid rules on these patients.
Thank you very much.